Typhoid fever, also called enteric fever, is caused by Salmonella bacteria. Typhoid fever is rare in places where few people carry the bacteria. It also is rare where water is treated to kill germs and where human waste disposal is managed. Places with the highest number of cases or with regular outbreaks are in Africa and South Asia. It is a serious health threat, especially for children, in places where it is more common. Food and water with the bacteria in it cause typhoid fever. Close contact with a person who is carrying the Salmonella bacteria also can cause typhoid fever. Symptoms include high fever, headache, stomach pain, constipation, or diarrhea. Most people who have typhoid fever feel better about a week after they start treatment to kill bacteria called antibiotics. But without treatment, there is a small chance of death from typhoid fever complications. Vaccine against typhoid fever can provide some protections, but they can't protect against all causes of illness caused by other strains of Salmonella. Vaccines can help lower risk of getting typhoid fever. Symptoms of typhoid fever. Symptoms are likely to start slowly, often showing up to 1 to 3 weeks after exposure to the bacteria. Early illness symptoms include fever that starts low and increases throughout the day, possibly reaching as high as 104 degrees Fahrenheit, 40 degrees Celsius. Chills, headache, weakness and fatigue, muscle ache, stomach pain, diarrhea or constipation are the common symptoms. People also may have a cough, loss of appetite and sweating. Later illness symptoms include a few weeks after symptoms starts, the illness can cause problem in the intestines. People may have stomach pain, very swollen stomach, as infection caused by gut bacteria spreading throughout the body called sepsis. People suffering from typhoid fever may become confused, not be able to pay attention to anything around them, not be able to react to the world around them. These are life-threatening complications. In some people, symptoms may return up to a few weeks after the fever has gone away. The probable complications of typhoid fever are damage to intestine. Typhoid fever complications can include damage and bleeding in the intestines. Typhoid fever also can cause cells in the walls of the small intestine or large bowel to die off. This allows the contents of the gut to leak into the body. That can cause severe stomach pain, vomiting and infection throughout the body called sepsis. Damage to the intestines can develop in the later part of the illness. These life-threatening complications require immediate medical care. Other possible complications include inflammation of the heart muscle called myocarditis, inflammation of the lining of the heart and valves called endocarditis, infection of major blood vessels called mycotic aneurysm, pneumonia, inflammation of the pancreas called pancreatitis, kidney or bladder infections, infection and inflammation of the membranes and fluid surrounding the brain and spinal cord called meningitis, psychiatric problems such as delirium, hallucination and paranoid psychosis. How typhoid is caused? A bacteria strain called Salmonella enterica serotype typhi causes typhoid fever. Other strains of Salmonella bacteria causes a similar disease called paratyphoid fever. People pick up the bacteria most often in places where outbreaks are common. The bacteria passes out of the body in the stool and urine of people who are carrying the bacteria. Without careful hand washing after going to the washroom, the bacteria can move from the hands to objects or other people's. The bacteria also spreads from a person who carries the bacteria. It can spread on food that isn't cooked, such as raw fruits without a peel. The place where water isn't treated to kill germs, you can pick up the bacteria from that source. This includes drinking water using ice made from untreated water or by drinking unpasteurized milk or juice. Who are the typhoid carriers? Even after antibiotic treatment, a small number of people who recovers from typhoid still have the bacteria living in their bodies. These people are known as chronic carriers. They no longer have symptoms of the disease, but they still shed the bacteria in their stool and spread it. So to take care, we have to be very careful and we have to maintain the cleanliness as I have mentioned earlier. If suppose you have all these kind of symptoms mentioned in the video, you don't have to wait for more than a week. You immediately have to take doctor's treatment. If you don't take treatment on time, it can turn into a dangerous situation. And as I have mentioned earlier, the condition can get worse. So take care of yourselves. I hope you might have liked this video. If you have liked this video, then please hit the like button. And if you have not yet subscribed our channel, then please subscribe our channel as soon as possible. If you have any comments, then please comment below. I'm signing out for today. I will be back soon with another interesting video. Till then, stay tuned and bye-bye.